I attended my first funeral for a friend that I lost due to COVID this last weekend, socially distanced and much smaller than it would have been. But I know that many have suffered loss, brothers and sisters, mothers and fathers, aunts and uncles, and we now continue to see our state on this exponential growth curve that we must stop to save lives and avoid overflowing our hospitals. So due to the grim news of the rapid increase in hospitalizations, we are taking action to prevent a catastrophic breach of health care. That means that several counties are going into a red phase, which is a severe risk phase, which results in additional steps to make sure that they can recover and avoid any kind of stay-at-home or shutdown or lockdown.
What makes this different from March and April, as I've been asked quite a bit from the media, is that we now know more about this virus than we knew back then. We know more about the treatment and the steps to take to appropriately remove the opportunity for this virus to spread from person to person. Our hospitals have had time to prepare, but unlike in March and April, staffing is now a challenge after several months of sustained community spread and the sheer amount of cases we're experiencing today. Doctors, nurses, and hospital staff are once again carrying us on their shoulders, and we as individuals must step up to lessen the burden on them and everyone else.
In addition to these public health measures, I'm calling the legislature into a special session to provide immediate relief for the economic and financial hardships that many Coloradans and small businesses are facing. Extraordinary times call for extraordinary actions. I'll be asking the General Assembly to take up critical legislation that will help Colorado families and Colorado small businesses survive these challenging winter months ahead to bridge us to the vaccine.